ਵੈਲਕਮ ਟੂ ਦਿਸ ਐਪੀਸੋਡ ਆਫ ਦਾ ਹਰਪ੍ਰੀਤ ਸਿੰਘ ਸ਼ੋ। ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਵਾਂਗੇ ਮਿਸਟਰ ਐਲਨ ਗਲੈਸਟਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ ਅਤੇ UBC ਦੇ ਵਿੱਚ ਐਜ਼ ਅ ਫਾਰਮਰ ਕਲੀਨਿਕਲ ਇੰਸਟਰਕਟਰ ਵੀ ਕੰਮ ਕਰ ਚੁੱਕੇ ਹੈਗੇ ਨੇ। ਅੱਜ ਦੇ ਵਿਸ਼ੇ ਵਿੱਚ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਤੁਹਾਡੇ ਨਾਲ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹਾਂ, ਉਸ ਦੇ ਵਿੱਚ ਤੁਹਾਨੂੰ ਦੱਸਾਂਗੇ ਕਿ ਜਿਸ ਤਰ੍ਹਾਂ ਅਸੀਂ ਪਿਛਲੇ ਐਪੀਸੋਡਸ ਵਿੱਚ ਗੱਲ ਕੀਤੀ ਕਿ ਮੈਡੀਕੇਸ਼ਨਸ ਦੀ ਲੋੜ ਹੁੰਦੀ ਹੈ ਆਪਣੀ ਪੇਨ ਨੂੰ ਕੰਟਰੋਲ ਕਰਨ ਲਈ, ਪਰ ਅੱਜ ਬਹੁਤ ਸਾਰੇ ਹੋਰ ਆਲਟਰਨੇਟਿਵਸ ਵੀ ਅਵੇਲੇਬਲ ਨੇ। ਕਿਹੜੇ ਉਹ ਆਲਟਰਨੇਟਿਵਸ ਨੇ ਤੇ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਧਿਆਨ ਰੱਖਣਾ ਚਾਹੀਦਾ ਹੈ, ਆਓ ਇਹਦੇ ਬਾਰੇ ਜਾਣਕਾਰੀ ਲੈਣੇ ਆ ਐਲਨ ਗਲੈਸਟਰ ਤੋਂ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you, Harpreet.
Thank you. So today we would like to know a little bit about the various alternatives which are available, because when you talked about the side effects of having medications, one always has to rethink that is it feasible just to control that pain for a short time. Its ramifications can be bad for you later on if you are taking excessive medicines.
That's correct.
So alternatives, when you talk about, what are the various forms of alternatives?
There are so many, and I've focused on just a few.
Okay.
The way to help yourself and myself. I mean, the number one problem that clients come into Mark's Pharmacy at 80th and Scott Road is they have muscle or joint pain.
Okay.
So, a typical client will come in and they're complaining, if they're a grocery clerk and they're scanning all those groceries all the time, it's this repetitive strain injury.
Right.
If they're a carpenter and they're twisting their screw all the time, sometimes they don't have a drill.
Right. But even with the drill, it's heavy,
Yeah, the drill is heavy, I know,
yeah.
or you're doing something physically active, or even, a housewife who's constantly making up the bed or constantly picking up a small child.
Right.
A mother or grandmother, whatever, and their wrist hurts them.
That's right.
So what do you normally take? Well, you go reach for, bottle of Tylenol,
yeah.
or you put some rub on and it's smelly.
Yeah.
And people just don't like that. If you come into Mark's Pharmacy in 30 seconds, I guarantee that if you've got that kind of pain, say just for example, whether it's in your wrist, in your shoulder, in your back, in your knee, in your ankle, if you got anything, I can demonstrate to you in 30 seconds that your pain will go away.
Right.
Now, will it go to zero? No.
So next time if I have some pain, I'll just be calling you.
You've got to call me and come in. So let me show you what I would do.
Okay.
If your wrist hurt and you couldn't move it,
Right.
you put your arm down on the table,
Okay.
and I roll the muscles, okay? Literally, I'd use two hands, but
Right.
here I only have one. And after 30 seconds of rolling, because why do you feel pain? Well, there's too much tension in your muscles, actually.
Right.
Because it's chronic use injuries are all about your muscles not relaxing.
Right.
This is a tool invented by a chiropractor in the States, in America. And if you roll top and bottom for 30 seconds,
Right.
okay, that's all I'm going to do is roll here, and then
So the blood flow
roll
has become better, and because of that you feel better.
two things. You're right. Number one is blood flow. Number two is the other sewer system of the body. The circulation of the body is called the sewer system, lymphatic drainage.
Right.
We stimulate more blood flow. We relax the muscles.
Okay.
See, the muscles are all attached to ligaments in our hands.
Right.
And they go through this narrow space in our wrist, right here. When the space is, when the ligaments are too tight,
Right.
they irritate everything there. The ligaments are just like steel bands. They don't move, they don't stretch, they don't grow, they're the same. The only thing that move is the muscles. So it's the muscles in our arm. If you ever did this to your wrist, there's nothing moving here except your wrist. And you feel this, all these muscles are moving. When they're too tight, they cause you pain.
Okay.
30 seconds, guaranteed, for your wrist,
Right.
for your knees, for your back. For people walk in with frozen shoulders, and they can't move more than here. I literally roll them on their shoulder.
Right. And
Okay.
the
30
result
seconds
is that.
later, they reach up there.
Wow.
Now, some don't reach up there, but I know that they'll go higher
Right.
than when they walked in.
Okay.
So, number one thing,
Right.
called the stick.
Okay.
Okay. Number two, this works in 60 seconds.
Okay.
This is, at Mark's Pharmacy, my focus is on alternative health. Magnesium has been written up for many years. People sit in Epsom salts in their bathtub. You've heard of that.
Yeah.
Well, what's in Epsom salt is a form of magnesium.
Right.
Well, I have another form of magnesium which I dissolve in liquid, in basically water-based,
Right.
And we have it at a concentration that again, you'd come in if there's any pain left in your wrist after I rolled it for 30 seconds. So I just spray it on your wrist. Come on, spray. Okay. We rub it in just like that. It's just water.
Okay.
It disappears. And within 60 seconds, what you start to feel in your body is warmth.
Okay.
Okay. Once it gets warm, the pain goes away. And it's just because we lack magnesium in our diet.
Right.
The stat I saw was that 40% of North Americans lack magnesium, mainly because of our diet processed foods. If we have a higher level of magnesium, you won't feel the pain as much.
Okay.
It's like you have a thermostat in your body, and it's set to be really sensitive to any time there's a little bit of pain, to shoot off a signal to your brain that says, pain, pain, pain. By adding the magnesium, we just turn down the thermostat so that it won't be that sensitive to pain.
So just spray and scrub and that's it.
And rub it in. I will give you a free sample.
Right. Thank
when
you.
you come into Mark's Pharmacy. And you're in pain.
Right.
And anyone can come in. We're so to help you. So 2 things that literally in 90 seconds, if you have muscle or joint pain, I can help you.
Okay.
Okay. Now we get a little more tough.
Okay.
If you don't respond to these 2 quick things, what's the next step? The next step is, let's review quickly, how do we have pain? We have pain because you have, number 1, damaged tissue.
Right.
Number 2, that causes swelling. The body swells up. Everyone's experienced it. You get pain, whether you got a bad burn or you twist an ankle, a wrist, an elbow. You get hit, things bruise up, and then you have pain. So the key thing is, if we can get the body sewer system, that's called the lymphatic system, to drain away the swelling, to drain away all those pain chemicals that are sitting there, say, in your wrist, or in your arm, or in your back, or in your spine. Because how many people have said, oh, I got sciatica. Now, all sciatica is there's a pressure on the nerve in your spine because of swelling. This product here, it's called Thermoflow. So it comes in all different kind of sleeves, knee, elbow, wrist. What I brought here is a patch that can go anywhere. You don't have to buy the sleeve of the wrist. And what you will do is this adhesive patch, I'll show
just put it across.
You just put it on. So if you got back pain, and you can cut it to size, you just slap it on your back. If you experienced, actually wrist pain, you just cut it to size. And if it didn't go away with the stick or the spray, you just cut it to size and place it here, whatever worked. Literally, we got a 30-day money-back guarantee that this product will help take away your pain. So, and it's working on the basis of reflecting the body's own heat, which stimulates the body sewer system to drain away the pain chemicals. At the same time, we have more blood flow to the area because we stimulate reflecting heat back in the body. So when there's more blood flow, there's more oxygen, there's more nutrients, better healing will happen. So
various options are available now for the customers, and they can take anything and get themselves fine.
That's right.
And what's that 4th thing I was seeing this bottle?
This 4th thing, really interesting. This contains duopeptase. Duopeptase, it contains a number of ingredients. The most interesting one, and the one that seemed to be, in my opinion, is the most powerful, is an enzyme. So remember what happens when you injure yourself. Now, enzymes, all they do is eat up dead tissue. Like if you remember a Pac-Man, it's really old, dates me, I'm sure. Just going around eating up other Pac-Man in this game. Well, inside this bottle, in every capsule, it has the enzyme that's going around in the blood. By Mother Nature, we don't understand how, we just are using it. This enzyme eats up dead, damaged tissue. Remember, the reason it's swollen in your wrist, swollen in your back, swollen in your arm, you have damaged tissue. It's broken, it's dead. And the body can't clean it up fast enough. We have our own system to get rid of dead tissue. It just doesn't work very fast. By taking extra enzymes, it quickly removes the dead tissue. And therefore, if there's no dead tissue, there's no reason to have swelling, therefore there's no pain. And it can literally work, I've seen it work in an hour and a half, or sometimes it takes 3 weeks. It all depends on you. But if none of these work, then we got to go down to the reason why you feel pain, which is damaged tissue, and this duopeptase does it, and it's natural products, no adverse effects.
Thank you very much for this information. We'll go for a small break, come back, and there are other options also available like light therapy and other things also,
yes,
which can be helpful. We'll talk after this break. ਸੋ ਐਲਨ ਨੇ ਜੋ ਅੱਜ ਗੱਲ ਸਾਨੂੰ ਦੱਸੀ ਕਿ ਜ਼ਰੂਰੀ ਨਹੀਂ ਕਿ ਦਵਾਈਆਂ ਨਾਲ ਹੀ ਤੁਸੀਂ ਆਪਣੇ ਆਪ ਦੀ ਜਿਹੜੀ ਪੇਨ ਹੋ ਰਹੀ ਉਸ ਨੂੰ ਖਤਮ ਕਰਨਾ ਹੈ, ਕਿਉਂਕਿ ਦਵਾਈਆਂ ਦੇ ਸਾਈਡ ਇਫੈਕਟਸ ਹੁੰਦੇ ਨੇ। ਬਹੁਤ ਸਾਰੇ ਲੋਕ ਅੱਜ ਚਿੰਤਤ ਨੇ ਕਿ ਇਹਨਾਂ ਦੇ ਜਿਹੜੇ ਸਾਈਡ ਇਫੈਕਟਸ ਨੇ ਉਸ ਤੋਂ ਬਚਣ ਲਈ ਆਲਟਰਨੇਟਿਵ ਮੈਡੀਸਿਨਸ ਦਾ ਇਸਤੇਮਾਲ ਕੀਤਾ ਜਾਏ। ਤੇ ਅੱਜ ਇਹਨਾਂ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਜਿਸ ਤਰ੍ਹਾਂ ਇੱਕ ਸਟਿਕ ਦੀ ਵਰਤੋਂ ਕੀਤੀ, ਉਸ ਤੋਂ ਬਾਅਦ ਮੈਗਨੀਸ਼ੀਅਮ ਸਪਰੇ ਜਿਹੜਾ ਹੈਗਾ, ਜੇਕਰ ਉਸ ਨੂੰ ਸਿਰਫ ਸਪਰੇ ਨੂੰ ਤੁਸੀਂ ਆਪਣੇ ਸਰੀਰ ਤੇ ਪਾ ਕੇ ਜਿੱਥੇ ਦਰਦ ਹੋ ਰਹੀ ਹੈ ਉੱਥੇ ਰਬ ਕਰ ਲਓ ਤਾਂ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ 60 ਸੈਕਿੰਡਸ ਤੋਂ ਬਾਅਦ ਉਹ ਤੁਹਾਡਾ ਜਿਹੜੀ ਪੇਨ ਹੈ ਉਹ ਖਤਮ ਹੋ ਸਕਦੀ ਹੈ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ ਕਿ ਅੱਜ ਮਾਰਕੀਟ ਦੇ ਵਿੱਚ ਬਹੁਤ ਸਾਰੇ ਐਸੇ ਪੈਚਸ ਅਵੇਲੇਬਲ ਨੇ ਜਿਹੜੇ ਕਿ ਤੁਸੀਂ ਆਪਣੇ ਸਰੀਰ ਨੂੰ ਲਾ ਕੇ ਉਹਨਾਂ ਨੂੰ ਵੀ ਠੀਕ ਕਰ ਸਕਦੇ ਹੋ, ਤੇ ਨਾਲ ਹੋਰ ਜਿਹੜੀਆਂ ਕੁਝ ਨੈਚੁਰਲ ਮੈਡੀਸਿਨਸ ਨੇ ਉਹਨਾਂ ਦਾ ਸਹਾਰਾ ਲੈ ਕੇ ਵੀ ਤੁਸੀਂ ਠੀਕ ਹੋ ਸਕਦੇ ਹੋ। ਲਾਈਟ ਥੈਰੇਪੀ ਤੇ ਹੋਰ ਜਿਹੜੇ ਹੋਰ ਅਲਟਰਨੇਟਿਵ ਮੈਡੀਸਿਨਸ ਨੇ ਉਸ ਦੇ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਇਸ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ। ਸੋ ਵਨਸ ਅਗੇਨ ਵੈਲਕਮ ਬੈਕ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ ਜੀ। ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਵਾ ਰਹੇ ਹਾਂ ਮਿਸਟਰ ਐਲਨ ਗਲੈਸਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਨੇ ਤੇ ਸਾਨੂੰ ਦੱਸ ਰਹੇ ਨੇ ਕਿ ਹੋਰ ਕਿਹੜੇ ਵੇਰੀਅਸ ਆਪਸ਼ਨ ਸਾਡੇ ਕੋਲ ਅਵੇਲੇਬਲ ਨੇ। ਜੇਕਰ ਕੋਈ ਦਰਦ ਹੋ ਰਹੀ ਹੈ ਤੇ ਦਵਾਈ ਨਹੀਂ ਲੈਣਾ ਚਾਹੁੰਦੇ ਤਾਂ ਹੋਰ ਅਸੀਂ ਕੀ ਕੁਝ ਕਰ ਸਕਦੇ ਹਾਂ। ਲਾਈਟ ਥੈਰੇਪੀ ਦੇ ਬਾਰੇ ਮੈਂ ਇਹਨਾਂ ਨੂੰ ਪੁੱਛਣਾ ਚਾਹ ਰਿਹਾ ਸੀ ਬ੍ਰੇਕ ਤੋਂ ਪਹਿਲਾਂ, ਆਓ ਹੋਰ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈਂਦੇ ਹਾਂ। So we have heard a lot about light therapy, whereby red light used to be used for muscle relaxation, and that used to say that the blood flow has increased after the light is used. And today we find there are various other means which are also being used. So is light therapy still relevant?
Yes. I actually do light therapy at Mark's Pharmacy, 80th and Scott Road in Delta. And basically, here's what the research says. When you take, it's called near infrared, so that's warm light. You know, when you come out in the sun, how many people feel, oh, it feels so good because the warmth you feel.
Right.
Not only the sunlight, but the warmth. So when we focus on red lights, blue lights, and just the warm light of the sun, that kind of frequency.
Right.
When you put that on the skin, and you have a problem, two things happen. First one is the light therapy stimulates release of a product called nitrous oxide. Nitrous oxide is necessary.
Okay.
To open up our blood vessels, increase blood flow. Okay, it actually increases blood circulation in an area. So if you have had pain in a joint, pain in your muscle due to an injury, if you know your back or your arm, wherever you had the injury, it's long-term and chronic, and no one seems to be able to help you. This light therapy stimulates increased blood flow because that could be the reason why you're feeling pain.
Right.
Not enough because you damaged the tissues there and the body hasn't been able to heal itself. By putting the light on, we increase the blood flow, number one. So with nitric oxide release, it's really good science on this. Number two thing, it stimulates the cells to actually be more energetic. So it's like giving more energy to the cells there so the healing can happen.
Okay.
It actually releases something called ATP, which is the energy molecule in every cell. Every cell in our body's got a little steam engine. It's a chemical steam engine. And if you pour gasoline on its fire, what's going to happen? The cell is going to work better.
Right.
So that's what happens with light therapy. And light therapy takes about 20 to 40 minutes.
Okay.
For a session. And for pain, specifically, you need approximately 3 to 6 sessions.
Okay.
To become pain-free and make sure that therapy works.
Right. We also hear about magnets. They are much in vogue today. How helpful are the magnets in alleviating pain?
Okay, so magnets do work. I mean, I used to see people walk around with a magnetic bracelet and kind of laugh at that. But recent science has shown, just like using thermoflow, okay, this heat sensitivity or the lights, magnets are basically doing the same thing.
Okay.
They are allowing the body to increase blood flow to the area and therefore promote healing.
Okay.
So by increasing blood flow, we get more healing, including the sewer system of the body, draining away pain chemicals. So it works very similar to the far infrared rays of light therapy and thermoflow.
Okay. I've also heard about CNAG. What is this?
Okay, CNAG, this is it's actually an old supplement called vitamin C with N-acetylglucosamine.
Okay.
Now, studies were done in the 80s at UBC Hospital, actually, on this supplement.
Okay.
It is actually been approved by Health Canada for inflammatory bowel disease, which is all about inflammation in our gut.
Right.
So people who have IBS, it's called, you may have heard of that, which is, irritated bowel symptoms, whatever you want.
Right.
you've got a stomach problem and it hurts and there's cramping. By taking this product, you take actually 3 capsules in the morning and 3 at night. Many people, my clients, find relief from that pain. Now, it is an anti-inflammatory.
Right.
So not only does it relieve your gut of pain, if you're feeling pain in your joints and you're taking, Advils or Tylenols or whatever, you need to come and try this, because this is not going to irritate your stomach. It's very safe to use, and I've had really good feedback from clients telling me how effective it is, not only on their gut, which is irritated and swollen, but on the rest of the pain in the body that's caused by swelling.
Right.
So anytime you have pain that's caused due to swelling and irritation, this helps not only your gut but the rest of your body.
Okay, and briefly in a minute or so, if I find there are some other bottles also, what are these?
Okay, Traumeel. Traumeel's been around for probably 50, 60 years.
Okay.
It's made in Germany, where they're really interested in natural alternatives to medicine. This, instead of using A535 or any of those smelly rubs for an injury, you put the Traumeel on, it'll do the same job.
Okay.
Okay. Number 2, the last one we talk about is Immunicare.
Okay.
Immunicare has a natural plant product called beta-cytosterol. All you need to know is that it's extremely effective for people with arthritis.
Okay.
It helps decrease the pain and swelling of that specifically. It actually affects the immune system, because the immune system is overstimulated and you're causing pain and swelling. You downregulate it and those symptoms disappear.
So there are various means today which are available in the market, and anybody can take advantage of those instead of having the medicines. Thank you very much for this information. Thank you. ਸੋ ਅੱਜ ਐਲਨ ਗ੍ਰੇਸਨ ਨਾਲ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਉਸ ਵਿੱਚ ਵੇਰੀਅਸ ਆਲਟਰਨੇਟਿਵ ਮੀਨਸ ਦੇ ਬਾਰੇ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ, ਤੇ ਇਹਦੇ ਵਿੱਚ ਇਹਨਾਂ ਨੇ ਲਾਈਟ ਥੈਰੇਪੀ ਦੀ ਗੱਲ ਕੀਤੀ, ਮੈਗਨੇਟਸ ਦੀ ਗੱਲ ਕੀਤੀ, ਉਸ ਤੋਂ ਇਲਾਵਾ ਇਹਨਾਂ ਨੇ ਸੀ ਨੈਗ ਜੋ ਹੈ ਉਹਦੇ ਬਾਰੇ ਵੀ ਦੱਸਿਆ, ਅਤੇ ਨਾਲ ਕਈ ਵਾਰੀ ਜਿਹੜੀ ਸਮੈਲੀ ਅਸੀਂ ਲਾ ਲੈਂਦੇ ਹਾਂ ਦਵਾਈਆਂ ਜਿਹੜੀਆਂ ਕਿ ਅਸੀਂ ਨਹੀਂ ਚਾਹੁੰਦੇ ਆਪਣੀ ਬਾਡੀ 'ਤੇ ਲਾਉਣੀਆਂ, ਤਾਂ ਅੱਜ ਨੈਚੁਰਲ ਚੀਜ਼ਾਂ ਜਿਹੜੀਆਂ ਅਵੇਲੇਬਲ ਨੇ ਉਹਨਾਂ ਦਾ ਬੈਨੀਫਿਟ ਵੀ ਲਿਆ ਜਾ ਸਕਦਾ ਹੈ।